phone, so we will go to her after Minister Coffey makes a short statement. So thanks, and I'll hand it over to Minister Coffey.
Great. Well, good afternoon, and thank you for coming today, and thank you for your forbearance as we work through the technical issues. So pleased to be here today to talk about Bill 4, the Alberta Healthcare Insurance Amendment Act 2022. And this act bill is really quite straightforward. It's part of the government's commitment to a collaborative relationship with physicians focused on partnership and innovation. The bill proposes repealing Section 40.2 of the Alberta Healthcare Insurance Act. This section of the Act allows government to terminate compensation-related agreements, such as the one we had with the Alberta Medical Association. This legislation is no longer required given the terms of the new agreement that we have reached between the Government of Alberta and the AMA. I am very pleased that over 70% of voting physicians supported this new agreement. With its concrete solutions and significant investments, the new agreement will address the unprecedented pressures facing Alberta's health system, target areas of concern, and support Albertans' healthcare needs. Albertan physicians will continue to be among the highest compensated in the country, with an average increase of 4% over the 4-year term of the agreement. The new agreement puts a strong priority on primary health care, including a sliding scale of rate increases, with the highest increases for family physicians at 5.2%. Lump sum increases will be given to primary care networks of $20 million in each of 2022, 2023, and 2023, 2024. And this is being done to provide additional support for primary care while the Modernizing Alberta's Primary Health Care System panel work takes place. With additional targeted spending, including new supports for rural physician recruitment, spending on family medicine overall will increase by 8% over 3 years. While much of the increase will be provided directly to family doctors, targeted funding will go to programs like the Rural Remote Northern Program, the Recruitment and Retention Program. These programs directly benefit family doctors to help with the increased business costs that they are experiencing right now. About $750 million in new funding over 4 years is being invested to stabilize the healthcare system, including $260 million in targeted funding. This targeted funding is going toward physician recruitment and retention, incentives for physicians to work in rural and remote northern communities, physician support programs, and funding to assist physicians with business costs. We recently announced details on an agreed-upon 1% rate increase for physicians in each of the next 3 years and 1% recognition lump sum payment for the exceptional contributions made by physicians during the pandemic. This lump sum payment is worth approximately $45 million, or about $4,000 per physician. It will go to the AMA by the end of this calendar year for distribution to their members. We are also working with the AMA to implement the 1% rate increase for fiscal year 2022-23. The increase applies to fee-for-service and alternative relationship plan rates, providing an additional $46 million to physicians. As outlined in our new agreement, the rate increase is heavily weighted for specialties facing the greatest pressures. We are working with the AMA to distribute these increases across all doctors, including specialties. And they will be effective April 1, 2022, and are expected to be finalized and paid out by March 31st, 2023. Now, the first 3 years of the agreement provide rate stability. Year 4 will see implementation of results from a comprehensive market review based on comparisons with Ontario West jurisdictions. There will also be a global rate adjustment in Year 4 to reflect general economic and fiscal conditions at that time. There is the potential for binding arbitration for both the market review and global rate adjustments should we not be able to reach an agreement. Additionally, there will be gain sharing in years 3 and 4 of this agreement, where the AMA can receive 50% of any savings achieved by keeping cost growth below population and complexity. This legislation is another step in our relationship with Alberta's physicians to create a collaborative environment founded on mutual respect and trust with innovative ideas for the future. It is a commitment I made in the new agreement with the AMA, And we're taking immediate action through the fourth bill of this legislative session to fulfill the promise that we've made to Alberta physicians. I'm very happy to introduce this legislation and to move forward with the AMA in a new spirit of collaboration, partnership, and respect. And I'll now ask AMA President Dr. Rinaldi to say a few words, and she's coming in on the phone line. Dr. Rinaldi.
Yeah, thank you, Minister Copping, and apologies again for the technology glitches here. But thank you for carrying through on the commitment under our new AMA agreement to repeal Section 40.2. This is another important milestone on the road forward with the agreement. In recent weeks, we've seen other signs of progress, such as the lifting of the daily services cap. The AMA appreciates the timely collaboration that we have seen. Government and physicians have a great deal of work ahead together to improve access to care for Albertans and to stabilize physician practices, which are part of the infrastructure of the healthcare system. As for today, with the introduction of Bill 4, we are taking an important further step in rebuilding the relationship between government and the medical profession. When Bill 4 has been passed in the legislature and formally proclaimed, the AMA will withdraw our lawsuit. In the interim, we will remain focused on our main task of delivering quality care to Albertans and advocating on their behalf.
I think that's it from Dr. Rinaldi. Thanks very much, and thanks for taking time on what I think is a clinic day for you, Dr. Rinaldi. So we've got reporters in the room and a few online, so we'll start in the room, I think. It's great to be back in the TV room. Questions for Minister Copping and or Dr. Rinaldi?
Yes, hi, it's me. You repealed this section of the Act. Was it a mistake? Are you sorry? Do you have regrets to express to doctors about putting that clause into the Act in the first place?
So I am committed to building a collaborative relationship with the doctors. We have focused with Dr. Warren and now Dr. Rinaldi to develop a partnership. This is a very different time that we're in now. Previously, it was pre-COVID and prior to the pressures that we had on our system when we put this in place. But we need to move past that. And so I'm very pleased that I was able to work with Dr. Warren in terms of doing, entering into interest-based bargaining and reaching this agreement, and very pleased to be working with Dr. Rinaldi on implementing this agreement and living up to the commitments that we made in it. And this bill is one of those commitments.
But I don't hear regret. I don't hear that was a mistake on the path of my predecessor. Do you think that was an error?
Yeah, that was a decision that was made at that time, and it was a very different time. Right? We need to move past it, and we recognize we need to move past that and actually put in place an agreement that focuses on partnership and working together. And so that's what this agreement does. It removes, as part of it is to remove this act, but the provision 40.2, and that's what this bill does. But more importantly, it sets up a joint management committee to work through the number of issues and challenges that we are facing with the healthcare system and to be able to work together. So I'm very pleased that we were able to reach this agreement and we were able to move past the challenges that we saw before and work together, because there are tremendous joint interests between doctors and the Alberta government, the desire to want to provide care and ensure that we can continue to attract, retain, and compensate our doctors fairly and be innovative. And this agreement does that.
Can I ask
Thanks, Janet.
questions of Dr. Rinaldi? I'm not sure if she can hear me.
Sorry, I can't hear you. What did you say?
Sorry, I just had some questions for you, Dr. Rinaldi. I understand that you've agreed not to seek legal costs from the province. Can you give us an estimate of your legal costs related to this lawsuit so far?
No, I don't have that number, sorry.
Okay. And I'm also wondering if you've read the actual text of the bill.
Bill 4?
Yes.
Yes.
Okay.
Okay.
Thank you for the admirably concise answers. We can follow up separately, but so that's it for Lisa. Anyone else? Catherine?
Yeah, so you said that it was a different time as pre-pandemic. I understand that Bill 21 was brought in October 2019, but once the pandemic hit, the opposition said, hey, let's stop this war with doctors. We're going to need them throughout this pandemic. So why is this only coming now? Why did you not back down earlier when people were saying is a problem?
So as you know, I came into the role in September of last year, and my focus, the direction I had from the then Premier and my focus was on reaching an agreement with the AMA, because there's so many shared interests in the context of, you know, managing through the pandemic. So, you know, part of this was part of our discussions. You know, even at that early date, we had multiple conversations using an interest-based approach, and we're very pleased to be able to reach an agreement. And it took until the summer for us to actually reach an agreement, and then until September to get it ratified. This was an element, a part of that agreement. But the agreement is much more than just this. This is just one component of it. You know, if you look at it, the three themes, you know, partnership, stability, and innovation. And on partnership, it's not only this is one small part, but it's also having a management committee to look at a series of issues and help implement this agreement. Stability, you know, this agreement provides over $750 million, you know, increases into for doctors, and then a number of elements to be able to help them deal with business costs. And then innovation, it provides mechanisms for us to look at different ways to pay doctors, because we recognize that, you know, fee-for-service may work for some, but quite frankly not for all, and it doesn't necessarily get all the outcomes that we want. So looking at other methods of pay and how do we support that, and there's a commitment by both parties to work together on improving that and increasing, you know, alternative methods of pay on this. So, you know, very pleased with this agreement, but it took us some time to actually get there, but that time was time, quite frankly, well spent. And enabled us to actually reach this, you know, to my view, a very positive agreement, and enable us to work together to deal with the challenges that our healthcare system is facing.
And every province in the country, of course, has been dealing with these pressure on the healthcare system with this respiratory virus season, but not every province ripped up the agreement with doctors. So how did that decision in Bill 21 position us for where we are now?
So,
are we playing catch up?
So when we take a look at our compensation package, you know, we had then, and we still continue to have some of the highest paid doctors in the entire country. And I'm very pleased that, you know, if we look at the data as of September 30th, you know, we've had an increase of 176 doctors, you know, year over year. So we are continuing to expand doctors. Now, don't get me wrong. We still need more, right? And this is, you know, we're continuing to do this work, but this agreement helps lay the foundation for that in terms of ability to attract and retain. And we are continuing to attract doctors to the province and grow our doctors pool, and this will help us do even more.
Thanks. Anyone else in the room? So, okay, a couple more in the room, sure.
Just an off-topic question. You're quoted in an AHS release that was sent out this morning about the transition to DynaLife labs. Friends of Medicare has been critical of that move. Why is it the right move for Albertans? Long
Story short, it enables us to provide better service and while at the same time reduce our costs. DynaLife has provided services to Alberta for years. We did a competitive bid process. You know, they came forward as the winner of that process, and all the money that we are actually able to, you know, not only, you know, provide the service and additional service, but all the savings we can put back into the healthcare system, which is what we're doing.
Friends of Medicare suggesting it's become at the expense of worse working conditions.
So, I haven't seen their statement, so I can't comment on whether they said that or not. What I do know is that there was you know, as part of the transition, there was you know, an agreement by DynaLife to, you know, accept the terms and conditions, and, you know, because of in the contracts, like the unionized contracts, you know, there's a requirement, you know, in terms of secession rights that moving over. So I'm not sure what they mean by that, because that's my understanding is what's happening.
Okay. Thanks. Thanks. We'll just take one more in the room. Sorry, I got to move to the phone.
Western Standard. Are you confident this bill will help bring doctors into rural communities such as Cold Lake and St. Paul? I worked in this area and spoke with many residents who haven't been able to get a doctor. If this bill doesn't attract doctors to this area, what will the government do to entice more doctors to move to rural Alberta?
Yeah, so this agreement actually does have a focus on supporting programs that attract and retain doctors in rural areas. There's an additional, you know, $15 million generally for physician recruitment and retention, additional $12 million for the rural remote northern program. There's for all doctors in terms of, business costs, we're adding another $2 million to the Reside program, which is focused on truly remote areas in terms of building doctors. So, this agreement will assist us with that. And quite frankly, we're looking at other options. I had the opportunity to tour the province, speak with over 1,100 people, go to approximately 20 different communities, almost 40 workshops about what's working, what's not working, how we can improve it. Lots of things that we already are doing in terms of looking at, leveraging the immigration system to actually get more doctors to, and particularly to rural areas, and we're actually having success on that. In Lethbridge, for example, we're talking about shortages of family physicians. We have 17 over the last 12 months that are in flight or already working with more, and then work on more coming, and that's just one example. So significant amount of work doing on that, but we know we need to streamline that process to make it faster. So we're doing that work with the CPSA, and we're also looking at potentially expanding our med school programs as well. This, take a step back. This agreement will help set the foundation of attraction and retention, and there's a particular challenge in rural areas, and this bill is sort of one element of this agreement, and we're living up to our commitment in this agreement with doctors.
Follow up, Arthur, or was that it?
I can just add a comment.
Oh, sorry.
The recruitment of physicians to rural areas has been a problem for as long as I can remember, right? So this agreement is a step forward, but I mean, you have to consider all the reasons why physicians may or may not want to work in rural areas. It might be that they have 3 kids in hockey and they're not going to drive 100 miles a day to Edmonton to go to practices. So it's a step forward, but, the biggest barrier right now is the loss of physicians, and are we going to attract new physicians? And hopefully there's some stability in this agreement that med students coming out see a reason to work in Alberta. So it's a step forward, but it's not a panacea.
Yeah.
Thanks, Dr. Rinaldi. Arthur, was that it or follow-up?
That's it. He actually answered my follow-up.
Thanks. So I thought we had a bunch of reporters waiting on the line. We'll just take, but it turns out there are a few. We'll just take one and wrap up there. It's a busy day. Dr. Rinaldi's got to get back to her clinic. We've got to get in the house. So we'll take one from the phone, please.
Jason Herring, Calgary Herald.
Yeah, hi there. This is for the health minister. We do have what I think is fair to call an ongoing healthcare crisis at the Alberta Children's Hospital. AHS is taking measures like pausing respite care in order to redeploy staff. So, wondering, Minister, what you would say to parents impacted by and worried about these developments, and what your government's plan is to address this.
Help is coming. Our system is under strain. There's no doubt about that. And this is not just unique to, Alberta's Children's Hospital. We're seeing impacts across the entire country. Sick kids in Toronto, which is reducing surgeries. Hamilton, the CHEO in Hamilton is called nurses from the Red Cross. We haven't had to do that. We did temporarily move resources from providing some respite care to the Children's Hospital. Now there's some signs of that we may be hitting the peak of this current flu that's circulating. You take a look at the data last week. It seems to be topping off and some signs are coming down. We look at in schools. We look at the absenteeism rate that has dropped from 15% down to 6 or 7% as of last week, both in Calgary and Edmonton. And again, you look at the wastewater data on COVID, which again seems to be relatively stable. There's a couple areas where we may be seeing going up, but generally across the province, it's either stable or in a downward trend. So we are adding resources right now And this is, including, like at the Calgary Children's, the fast track to be able to treat people as they come in, treat them right away, and then get them out the door. And then we also, as we talked about last week, it was reported in the newspapers about, a new trailer there to be able to, for people who are waiting, that, and are less severe, they can wait there so that we can keep them out of the cold. But this is all part of building capacity across our entire system. We are continuing to invest in more people and in building capacity in terms of beds, and also capacity and alternate levels of care, so we can move people move faster through the system. So what we're seeing right now is it appears we may be at the peak, and then we'll come back down. So that's the short term. Longer term, we're continuing to add capacity, and quite frankly, that's one of the main reasons that we appointed Dr. Cowell as the official administrator to work with the AHS executive on focusing on emergency department wait times and the flow through the entire system, and make those changes as quickly as possible so we can address it, quite frankly, not only in our the kids' hospitals in Calgary and in Edmonton, but our hospitals across the entire system.
Thanks for that. Follow-up, Jason?
Yeah, sure. Just wondering if maybe you give me a sense on what could be on the table here. I mean, you mentioned the Red Cross being called in at the CHEO. Is that something that could happen here? Could we see broader pediatric surgical postponements? Can you give me a sense of that?
So we're not hearing any of that right now. We continue to build capacity generally in our system. I know this was a very difficult choice for AHS to make, to be able to do this on a temporary basis for a short period of time. And then, as I said before, it appears some signs that we may be at the peak of this bout of flu. Now, again, typically we have multiple bouts of flu over the course of flu season. So we may very well have another round of this sort of after Christmas and into New Year. But we are continuing to build capacity at the same time, add more resources into our emergency departments, and add more resources into our hospitals, and open up new beds. So that work is ongoing. So at this point in time, this is the decision made by AHS, saying the best way to actually meet the immediate need right now. We are continuing to build capacity, and we'll see what happens going forward.
Thanks, Minister. We'll wrap it there. As always, if you have more questions, you can follow up with me and or the AMA directly. And thanks particularly, Dr. Rinaldi, for joining us.
Thanks so much.
Thanks a lot.